So good morning. I'm Denise Rollard Barnes, publisher of the Washington Informer newspaper, and give yourselves a round of applause for making it out this morning. I know we all sat by our emails yesterday wondering whether we were going to have to come out today. I actually sent Kelly a note and I said, if it's tomorrow, do we have to do this outside? So she said, no, we'll be inside and then we can go out. So, and fortunately, it's a little bit better to do that. But I want to welcome you to the ribbon cutting for Community of Hope's new Conway Health and Resource Center. It's a beautiful, beautiful, beautiful facility. And I'm sure the folks in the Bellevue community are so happy to have you in the area. Are there any members of the Bellevue community here? Please stand. Let's recognize our Bellevue neighbors. Wonderful. I have lived, actually, I can't see my house because that apartment building's in the way, but I live about 2 blocks away from here. And while I've been in this neighborhood a long time, I certainly do remember when I think it was, I want to say a Rodman's, but it was a pharmacy right across the street. There was I think a CVS right here, which was something before that. That was a giant food store right across the street. Theater, that's right, the theater right across the street. I think I'm stealing Mayor Gray's thunder here. So I won't go any further because he's going to give us the history of the neighborhood. But there was, a couple of little seedy restaurants where the men used to like to hang out right down the street, strip joints and all that. So we had a diverse community with a lot of economic businesses and a lot of places where people could come and hang out. There's a place called home. And so we've lost some of that over the years, but we're so glad that we're starting to rebuild this community with a place that starts with something first. One, a place for the mind with the library across the street, and a place for the body and soul with the health facility right here. So I also want to take a moment, they just ran away, but I wanted to also acknowledge our musicians, Anna King and Asha Gardner, who are guitars. Oh, there they are. Thank you. And they are our musicians who are part of Pep Rally for Peace in the Streets that brought them here. And Gary also, we're going to learn more about this organization as time goes along. So I would like now to bring forward Pastor Christine Wiley, who is the co-pastor of Covenant Baptist United Church of Christ. And Covenant has been a wonderful partner for Community of Hope in the past few years, including hosting a nurse practitioner for a year and Community of Hope's job training program. We're pleased to have Pastor Wiley bless this space and this day. Pastor Wiley.
Good morning. Good morning. In Bellevue, I have been for 40 years. Covenant Church is just up the street, and I have aged over the years, and I've seen much change in this community, and we are praising God today for the vision that has come forth. Let us pray. Gracious God, where there is no vision, the people perish. And we are understanding that so many in our community, oh God, suffer for health disparities with body, mind, and spirit. But today is the day where we do away with marginalization. Today is the day where we bring forth a community of hope, where there will be health, and there will be good spirit and good emotion, oh God. We ask, oh God, that you would bring your spirit in this place, that it would fill every nook and every cranny. We thank you, God, for the vision. We thank you for the support of so many partners. We thank you that it was a community effort, even an effort that would bring people together. We understand that if it had not been for you, where would we be? So with this Conway Health and Resource Center, and with the District of Columbia, and with so many who care, and so many community members here, oh God, we are acknowledging what you have done. Bless this place, and we will be so careful to understand that it was all because of our Creator and those that you used with vision and care and hope. Let everyone say amen.
Amen. Thank you, Reverend Wiley. I hope I wasn't remiss. Did I forget to mention that my mother was here? Vera Abbott, who I believe was the founder of the Bellevue Civic Association. Is that correct?
Yes.
Sort of, she won't say. But anyway, let's welcome her. And I think one of the other presidents of Bellevue is here too. But where is she? Dion. Okay. All right. Nobody wants to take credit for this. I'll take credit for it. But I wanted to acknowledge her especially. So now, if you don't mind, I'd like to introduce Kelly Sweeney McShane, who has led Community of Hope since 2001, to share a little bit about why we are here today.
So I just want to start by wishing everyone happy St. Patrick's Day. I'm just going to pretend that it's still St. Patrick's Day. It's only 24 hours late. I've got my green on, and we've got the luck of the Irish here with us. So just welcome. I'm really so pleased to see so many friends and family and long-term co-workers and people I've worked with for many, many years to be here, to change their schedule at the last minute, and to really celebrate this such an exciting day for us. Today really marks a day that we are one huge, giant step closer to our vision of improving health and the quality of life for residents here in Ward 8 and in the Bellevue community. We started along this journey back in about 2010, where as part of the strategic planning process, the board said we really need to look at where we can continue to expand our health care. And the RAND report issued a report talking about a real need for an increase in primary care, specifically in this zip code of 20032. And also talked about the need for a broad range of services, that even though a lot of people in this community are insured, that there are some very poor health outcomes, and how do we improve those health outcomes. We were very pleased in January to open this building. And for us, the vision is that this space is a place of wellness, of healing, that's a real home for community members, that we're providing health, but also resources in general for the community. As you have a chance to tour the building, you'll see that we have 20 exam rooms. We have 11 dental operatories. We also have 6 rooms for therapy and behavioral health support in groups, and this large space that we can use for education, for partnerships, for wellness. I'd love to get a Zumba class in here if anybody knows any Zumba instructors, Donnie. That there's a lot of possibilities and opportunities that we can use in this space. At full capacity, we think that we'll serve up to 10,000 patients in about 40,000 visits. That's almost doubling the amount of care that we provide. We're also really excited about some of the partnerships that we have going on here. Particularly want to highlight Breast Care for Washington. Beth is here, and you'll have a chance to tour her space. They'll be providing the first 3D mammography screening services east of the river, are co-located in our building and will open in the next couple of months. We'll also be able to offer ophthalmology screening through a generous donor who's also going to spend his time doing those connections. And again, really looking at how we can bring in other partners in specialty care as we move along. We're also doing outreach and enrollment for the DC Health Link for people who are looking for insurance. But we know that people's health is impacted more than just by going to the doctor, that there's also a lot of social determinants of health. So our vision is also to use this space to promote economic development and wellness within this community. We've heard often how important jobs are in Ward 8 from community members, and so as part of the construction process, we had 10 Ward 8 members hired through the construction process. We also started a job training program to train Ward 8 community members in customer service skills. We've hired several of those graduates who are working with us on outreach and getting into our community, and are really committed to how we can continue to hire from this community. We've also really pleased, one of my favorite projects is take a look at all the beautiful art. A lot of there are featured local artists, particularly our beautiful, fun mobile in the lobby, Sheila Kreider, a Ward 8 artist, who I think if she's going to be here today to take a look at life pieces to masterpieces, just as a way to really provide uplifting and inspirations for the people in this building. And last but not least, oh, there's Sheila. Last but not least, our headquarters have moved to this space. And I know me and my staff have felt incredibly welcomed. And we hope that we can help get other businesses more involved in economic development in this neighborhood. All of this would not have been possible without many, many, many helping hands, many of whom are here today. I specifically really want to thank the DC government, the DC Department of Health, and the DC Primary Care Association that through the Medical Homes DC project was really a visionary and was in very early in the first days for a lot of the soft costs and beginning costs. It really would not have been possible without their ongoing support and $15.5 million. So that really, really helped get us where we are today. We also received $6.25 million from HRSA through the Affordable Care Act, and that was also a wonderful help for us to get us where we are. And then philanthropy really just helped us bring it home. So we're really pleased with our capital campaign of $26.5 million that we achieved that goal. Yes, huge. Bill and Joanne Conway contributed $1.75 million, some of which was used as a match and a challenge grant to help encourage other people to get involved, as well as supporting our job training program. And we were pleased to name this center in their honor. Unfortunately, Bill was not able to be here today with the change, but has been a great supporter. And then as you'll see listed in our program, and as well as on our Capital Campaign Acknowledgement Board, many foundations and institutions and individuals, the CareFirst Foundation, the Weinberg Foundation, CareFirst, LISC with both grants and interim financing, and just really grateful for that. We also had just an amazing development team. It was really, I think it's kind of weird to say, but we really had fun on this construction process. Forrester Construction was our general contractor. ZGF was the base building architects. Perkins & Will did the interior design. Gyro Lynch Development Partners were our development consultants. And Patton Boggs did pro bono work, legal work, pretty much for 5 years straight, and were wonderful partners, as well as LISC for our interim financing. So now the building is done, yay, and I feel like now the hard work really begins. Exactly, showtime. But I'm really encouraged, and again, have such positive responses from all of our community. I just want to reflect on one patient that I talked to on Friday, and I had the opportunity to talk with. She lives about 2 blocks away from here, and she said in the past she's had to take multiple buses, several hours to get across town to get health care. And because of that, didn't always make it to her appointments. She came on Thursday to see our dentist and just raved about the services that she came. She came on Friday to see our nurse practitioner and again was so excited and loving the space and the people that she met, and says she's bringing her 2 teenage sons next week. So for me, that really embodied what we're trying to be here. That's a one-stop shop for people. They can get medical services, dental services, education, mammography services, and that we're trying to be very flexible to respond to the needs of the community and adapt as we move along. So I thank all of you for your participation, for being here, and really look forward to continued partnership as we move and develop the services within this community. Thank you.
Does Kelly sound excited? Let's get excited with her. I'm excited too. Yes. As Kelly mentioned, this project would not have been possible without the early infusion of funding from the district's Department of Health in partnership with the DC Primary Care Association. Mayor Vincent Gray has been a long proponent of increasing access to health care through primary medical homes, and we are pleased to have him join us today as we cut the ribbon on this newest health center in Ward 8. Mayor Gray?
Good morning, everybody. It's a great day, isn't it? Unfortunately, we weren't able to cut the ribbon yesterday on St. Patrick's Day because the snow once again intervened. You know, for those who don't know, we've had 26 snow events in the District of Columbia since November 1st. And I really want to thank our folks at DPW and at DDOT for doing a fantastic job of getting the snow off the streets. We're actually getting good at it. And we're also getting good at some other things, too. First of all, I want to thank Denise for such a nice introduction. I want to thank Kelly also for the leadership she has provided here at the Community of Hope to be able to get this facility where it is today. I also would be remiss if I didn't recognize our Deputy Mayor for Health and Human Services, who herself has spent so many years working in the nonprofit sector and came to do this when we had a vision for what we were going to try to do here in the city, and especially BB, and that is to be able to make sure that the folks on the east end of the city had an equal opportunity like everybody else. It's amazing to me what confusion there is over something as simple as one city. One city really is a concept that says geography should not define your future in this city. That the geography should support the needs that you have, and that people ought to have services available to them as conveniently as they possibly can be. Healthcare has always been a challenge here, and then we wonder why health outcomes have never been very good. And a lot of it is because we've never really had a healthcare system over here. You know, we used to tell people, you know, don't go to emergency rooms to get, you know, for routine visits. Well, where the heck were they supposed to go when there wasn't anything else? You know, there was a time when all we had was DC General, and those who were, you know, diligent and vigilant enough figured out how to get across to DC General, and of course where they wound up in many instances was the emergency room. But this is yet another example of the change that is taking place, which we wanted to have happen. You know, the health outcomes here have always been very challenging. When I say here, I mean on the east end of the District of Columbia. Infant mortality, when I was the director of the Department of Human Services, was enormous. It was over 23 deaths per 1,000 live births. And we've been working now for years to try to bring that down. And we've actually gotten it down to a point where the last data we have indicate that citywide we are at 7.4 deaths, which is a huge drop. That's about a 2/3 drop. But the fact of the matter is it is still much too high here in Ward 8. It is still over 12, which is enormous. Ward 7 has come down to about 6. And you look at some of the other health indices like HIV and AIDS, you look at cancer, diabetes, heart disease, asthma, and a host of health issues that I think this clinic and other clinics that we are developing will have a major impact on by creating a primary health care system here in the District of Columbia. This is actually the third clinic that we've opened. Some have been in concert with Unity. We have the Anacostia Clinic, which was opened in May of 2012, and I believe Vince serves, 50,000 patient visits a year, which doubled the number there. Parkside, which just opened in November, tens of thousands of people, patient visits being accommodated there. And of course, you heard the data here as well. So this is a great day. It's an experience where hopefully a community now recognizes, and what a great name, Community of Hope, recognizes that there really is a reason to be hopeful about the future. With the library next door, which we opened, I guess, a little over a year ago, bringing that resource here and replacing what was the library before. And now the Atlantic Theater, Denise, is gone. And there are those who are sitting there saying, not a moment too soon. It used to be a part of a neighborhood system of theaters that we had in the city. There were lots of those theaters. They used to be called second-run movies. Anybody know what a second-run movie is? Yeah, it means it had been somewhere else first, right? And so it came out to the neighborhoods after that. And I guess the Atlantic Theater served its purpose, but now that will be redeveloped also. So, you know, we've seen some really important advances in healthcare. We've seen some important advances in unemployment. You know, when I came into office, the unemployment, and I'm glad you mentioned employment, not unemployment. I'm glad you mentioned that, Kelly. The unemployment rate in Ward 8 was 26.9%. And there was an article that I read that said it was the highest in the nation. We've worked pretty hard. Our One City, One Hire program has gotten now 9,100 people back to work who were out of jobs. And the majority of those folks have been here in, I won't say of the 8 wards, the ward that has had the highest level of employment under One City, One Hire are the folks in Ward 8. And the unemployment level has come down now from 26.9%, and it's still much too high, but it is down to 16.2, which is a drop of almost 11 points, one of the most pronounced drops of unemployment, certainly in this city, but probably anywhere on the East Coast. And if you don't know any differently, I'll just say everywhere, anywhere in the nation to be able to see that happen. So I'm delighted, too, that we've been able to use tobacco settlement funds. Tobacco settlement funds, for those who don't know, emanated from tobacco companies being sued for the product that they were selling people and the consequences to people. There are lots of jurisdictions that were involved in that litigation, and they have used, other places have used the funds for bridges and roads and things of unrelated to health care. We made the commitment from the very beginning to invest in building a health care system. We've invested some of that money in the hospital, the United Medical Center, and of course in building these clinics, working in concert with the Primary Care Association and our private sector community here in the District of Columbia. So it is great to be able to see this continue to happen. We know that people will be better served as a result of this. And, isn't it nice to be able to walk in a place that makes a value statement about people as well? Unfortunately, we've had far too many places over the years that were not only remotely, placed from where people live, but when they went in there, they probably got sicker from looking at the places and the condition of the buildings that they had to go into. So as somebody who's had a background in healthcare, it really is a great day for me to be able to be a part of the ribbon cutting. And now let's continue to work to build a primary health care system. We have a city which we have some of the highest levels of coverage for health insurance anywhere in the nation. 94% of our adults have health care insurance. That is second to Massachusetts among the states. And among children, we have 96% of our children who are covered, which is the highest level of coverage in the nation. Coverage is fine. Using that coverage is yet another issue, and that's what we've got to be able to do. We've got to be able to change healthcare behavior so that people don't see going to a healthcare practitioner as something you experience only when you get sick. Frankly, obviously going early is a preventive or early interventive technique obviously has the ability to be able to keep people from getting sick in the first place. With the convenience of a place like this clinic and other clinics that are developing across the city, I think you're going to see health care outcomes improve tremendously here in the District of Columbia. So again, Kelly and Community of Hope, thank you all very much. And let's get on with the business of being able to serve folks. And by the way, it's nice to see so many people now have showed up to be a part of this ribbon cutting. Now let's get everybody showing up to be able to take advantage of these services. Thank you all very much.
Thank you so much, Mayor Gray. We appreciate those comments and the encouragement that we think of a community of well people as opposed to a community of people who are sick and need aid. But this clinic was going to serve everybody. That's right. This medical home will serve everybody. And we're so glad to see so many folks here with us today. As you know, this project would not have, we keep talking about what made it possible. We ride through the neighborhood, we see a hole, we see bricks. So we know the storyline here is that none of this would have been possible without. And so now we're going to talk about this project not being possible without a $6.25 million grant from the Federal Health Resources Services Administration through the Affordable Care Act. And Joanne Grassi, who is the Region 3 Director for the U.S. Department of Health and Human Services, had planned to join us today, but due to the weather was unable to make the trip, and Kelly told us about that earlier. So it's always nice to talk to the other money person, and just to think, when you are sitting down with a group of folks and trying to figure out how do we address this issue, and you come up with this plan that sometimes seems very daunting. And I'm sure that Jacqueline Bowens and her staff thought about that when they talked about the ways that they wanted to continue to address the health care issue in Washington, D.C. But this project is the 11th of 12 projects under the D.C. Primary Care Association's Medical Home Initiative. And I'm so pleased to introduce to you Jacqueline Bowens, who is the CEO of DCPA.
I am very, very fortunate and also a little unlucky. I'll talk a little bit about why I'm fortunate, but I'll also say why I'm a little unlucky. They keep putting me behind the mayor when it's time to do this, these speeches, and he's so great. There's not a whole lot left for me to say. I mean, he really did capture everything, and I really want to first thank Kelly for the opportunity to be here this morning to speak on behalf of the DC Primary Care Association, as well as many of the board members who are here from DCPCA, who really is part of the team, also work together. Acknowledge Deputy Mayor Otero and really everyone who's worked collectively as a partnership to make this happen. I'm kind of a little bit like a Jackie come lately. I've really only been in this role for about 8 months now, 8 months, and it's been nothing but spectacular to really have this opportunity to be a part of really a vision to make a difference and truly an opportunity to move the needle, to bring resources to many of our underserved communities who may be underserved but are more than well deserved. And so this is really, really wonderful, a wonderful opportunity to be a part of and seeing this reality come true. And I think for me personally, it really is so fantastic to be able to think about not often, we often hear about what a community doesn't have. Let's talk about what a community has. And what this community has is this one-stop shop of all comprehensive primary care services to a well-deserved community. And I really cannot express enough the appreciation of DCPCA and our member boards to be a part and partner with the Department of Health and all aspects of the city who really made this a reality. And to now be a part of this team to actually be looking in terms of how we continue. This is just the beginning. How do we continue to work collectively in a partnership to improve outcomes? How do we show value to our community, to our residents? And this beautiful facility, this community of hope for our residents, for our community, really is just the beginning of that first step as we move forward. So on behalf of the DC Primary Care Association, we are so grateful and thankful for this wonderful opportunity to work and really show and exemplify a partnership. But there's more work to be done. We need to continue our outreach, to get into our neighborhoods, to really remind our folks that here is where they need to come first. So let's look at as many ways as we can to get the word out, to work together, to really work in partnership to move that needle. I'd also like to acknowledge, I don't know if Robin is here, but Robin Hausman, who has been the director of the capital projects at DCPCA, has really been on the forefront of all of these initiatives. And so I'd like to really acknowledge her, and I'm not sure if she was able to make it here today, but to acknowledge her, to acknowledge the team at DCPCA, but lastly, but most importantly, to acknowledge the community. Because this is your dream, this is your vision, this is what you deserve, and this is really so much for all of us, a true example of partnership and how we get to do it right. So thank you very, very much, and looking forward to our continued partnership.
Jackie and I were talking a few minutes ago, Mayor Gray, when you talked about the neighborhood, the network of theaters. And this is sort of an aside story here, but she said to me, y'all remember those days. I used to go to the Kennedy Theater in Northwest, and I said, so did I. She said, yeah, I used to live in such and such a street. And I said, I wasn't far from you. So I said, what junior high school did you go to? She said, I went to Rabeau. I said, so did I. So I said, well, what high school did you go to? She said, I went to Roosevelt. I said, I went to Coolidge. She said, oh, okay. I was supposed to go to Roosevelt. Really? So what year did you graduate? And that's when the conversation ended. But, it just goes to show we love this city, and it's so good to be on the same team, with folks who in Leadership Washington together, Justice. So we've had a lot of paths crossing. And hopefully we'll continue at places like this where we're talking about what's best for our city. This project would also not have been possible without the generosity of many local area foundations and individuals. And due to the schedule change, unfortunately, William and Joanne Conway of the Bedford Falls Foundation, who contributed $1.75 million towards the construction of the building and towards starting a job training program in customer service skills for entry healthcare workers. I mean, they're unable to be here. But still, let's give them a round of applause, because that's nothing to sneeze at. And maybe when the weather really gets better, if that ever happens in Washington for more than a day, we can invite the Conways here and really have an event for them, Kelly. It would be nice to say thank you to them. One of our valued longtime partners is CareFirst Blue Cross Blue Shield. They provided a grant of $240,000 for the medical equipment, as well as have supported Community of Hope's transition to electronic health records and the Family Health and Birth Center breastfeeding program. And we're pleased to have Julie Wagner, the Vice President of Community Affairs, to join us today to offer a few comments. Julie?
Thank you very much, Denise, and thank you for having us here. We are really proud to join the other funders, DC, PCA, the Health Department, Health and Human Services, the O'Neill Foundation, and the many others who joined on this project to provide over 10,000 patients with care. It's just so rewarding for us. We, as Denise mentioned, we partnered back in 2010, and Bob Sloan, who is a CareFirst board member and also Community of Hope board member, asked us to come out and tour the facility. And I went out and I was just so impressed with the healthcare and the wraparound services that were provided at Community of Health. But we were also so impressed with the leadership under Sweeney McShane, and we were really excited to join them on their journey in transitioning to electronic health records. When Kelly came to us and said that the Conways had made this very generous initial gift and would we join them on the journey, we jumped in. We were happy to do so. It is part of our not-for-profit mission to be involved in the community, and many of our other partners are here today that I see. But without strong community partners, we can't do anything. We can provide some of the funding, and we are pleased to do so, but without all of the folks like Community of Hope here and what they'll be doing in this facility, it just doesn't work. We're also proud to be able to join Breast Care for Washington to get them started in this facility, and so it is really gratifying just to see this beautiful building and know what it's going to do for so many people. So we thank you for this opportunity. We thank the other partners, because this is truly a partnership in bringing this to fruition, and we're excited to join them on this journey. Thank you.
And thank you, Julie. You know, this project would not have been possible. I told you that's the theme. It would not have been possible. Repeat that after me. It would not have been possible if I wasn't here today. No, you all were supposed to say that. If I were not here today, right? Because this is all of us. All of us have contributed in some way to making this possible. So last time I'll say this, give yourselves a round of applause for helping to make this possible. We want to continue to feel a part of this forever and ever. But this project would not have been possible without the vision and commitment of a dedicated board of directors and staff. Chris Kearns, who is the newly elected chair of the board, and you got a great chair, I'm telling you. He just walks up and says, "Hi, I'm Chris Kearns." And I said, "You are somebody, I know that." Was chair of the capital campaign and the real estate committee, who provided oversight and vision every step of the way. Cornelia Steele, vice chair of the board, has been a patient at Community of Hope's almost since its inception, and is passionate about how Community of Hope can always keep the needs of patients and clients at the forefront of all it does. Cornelia Steele and Chris Kearns.
Good morning, everyone. Thank you guys for coming out, everyone. I guess I could talk about Community of Hope and the goodness and the compassion of care, but it would take almost 30 years to do that. But I want to thank everyone, all our supporters, volunteers, and everyone for coming out today and making this possible. As a longtime client, I remember when we started in just a small little room, had no vision of this, what Community Hope was going to be like. So I'm very excited, I'm very thankful, and I hope that this community enjoy Community Hope as well as the community that I've come from, the Petworth neighborhood, will enjoy it. Thank you very much for coming, and I'll be blessed. Thank you.
My purpose is to thank everyone here today who's had a hand in making this facility a reality. It's a lot of people sitting out there today, but I particularly wanted to give thanks to 4 people who are here, who are part of the advisory committee, and I'll ask them to stand, but hold your applause until the end. But these are really important people. the founder of Community of Hope, Reverend Tom Nees, the original board member, original board chairman, Bob Sloan, who's here today. Please stand. There is Annabelle Lockhart, who was a board chair and is part of the advisory committee. And of course, the ad hoc chair, who both Annabelle and Katie Poland brought us through this amazing, amazing journey. Thank you. Thank you. Well, not only them, but all of the rest of the community of Hope, volunteers, donors, staff, particularly who donate their services for a fraction of what they can be paid on the market. Everybody, volunteers, everybody together is part of the community of Hope. But I also like to address hope, because hope is what you see on the faces of the people who walk into that front door. And when they walk in here, they're looking for affordable health care, free health care, first quality health care. And not only that, but they get caring services. But I also want to focus on those same faces of the people when they walk out, because what you see is faces of appreciation. Those people say, the mothers say, thank you for the medical care I just got. Fathers are saying, thank you for the first-rate dental services I just got. Children, along with their families, are sometimes looking forward to the first home that they've ever had. When this center is fully operational, as Kelly has said, you'll see over 40,000 faces a year, all reflecting this appreciation. So even though today I say thank you on behalf of the entire Community of Hope, I want you to remember that every day there'll be thousands of thanks to you as long as this building stands. Thank you.
Thank you, Mr. Carnes. I'm telling you, when you walked in and he just sort of introduced us like, welcome to my house. And I felt extremely welcome, and I think he should feel very proud of what, and the board should feel very proud of what you have here today. So we're so glad. I'm going to take whatever this is, privilege, MC privilege or something, because we're supposed to go outside now and cut the ribbon. But the face of the folks who the residents will see when they come into this place will be the employees, the staff. And so I know many of them are standing in the back. I just want you all to kind of, if you don't mind, come on up front, because we want to see you, because folks will be seeing you. And people